Hello, and thank you for joining us for Wisconsin Parkinson Association's educational video series. I'm Jeremy Otte, Director of Outreach and Education with Wisconsin Parkinson Association. WPA provides hope, community, support, and resources for people with Parkinson's disease and their loved ones. Today, we are talking with Dr. Karen Blindauer, a neurologist with Froedtert and Medical College of Wisconsin in Milwaukee. Dr. Blindauer and I are going to discuss current and emerging medications for treating Parkinson's disease. Welcome, Dr. Blindauer. Thanks for joining us.
Oh, thanks for talking with me today.
Not a problem. You want to give us a little bit about yourself and your background?
Sure. For my background, I'm a neurologist and a movement disorder specialist. So that means after finishing residency, I did some additional training. So I did a 2-year fellowship at the University of Rochester in New York. And then I came to Milwaukee in 1999 and started the Parkinson and Movement Disorder program at the Medical College of Wisconsin. And I've been there ever since.
Excellent. Well, thank you. I'm glad you've been there. It's been a great program. I know a lot of people go through that program. So one of the first questions, we're going to talk about medications today. And one of the common ones I get is, when working with a newly diagnosed patient, what are the medications or treatments you want to consider and have them consider once they get started?
Yeah, that's a good question. So when I'm seeing a new patient for the first time, I think my approach is, let's come up with an individual plan that fits the individual patient. You know, it's not a one size fits all. So the first question I always ask is, does a person's symptoms bother them enough that they actually need to take a medication? Because not everybody with Parkinson's very early on has to start a medication. The medications that we have available today are just there to treat the symptoms. They're not slowing the progression of the disease, so there's no harm in waiting for taking medications if your symptoms aren't bothering you. So that's always the first decision point. Does somebody need medication, or are they doing fine without? If we make the decision that it's reasonable to start a medication, then we're looking at how severe are the symptoms, what symptoms are we targeting, how old is the patient, what other medications might they take, are they employed or retired, what type of job do they do, because all of that helps to decide in the medication that we choose based on the potency as well as the side effect profile. So in reality, any of the medications on the market today are a reasonable choice to start early in Parkinson's disease. Now, many people have the fear of starting carbidopa, levodopa too soon. A patient often comes with the concern, well, I don't want to use the medication because I've read it only lasts a few years and then the benefit goes away. So I don't want to use up my few years too soon. And that's unfortunately misinformation and misinterpretation. Or some patients may be concerned about the development of dyskinesias, which can happen when one takes carbidopa, levodopa for a number of years. So in a patient with milder symptoms, if they're young and they have concerns about dyskinesias over the long term, or knowing they're going to be treated for 30, 40 plus years, then we might think about an alternative to the carbidopa, levodopa, like medications in the category of the dopamine agonists, ropinirole, pramipexole, and rotigotine. So the potency is a bit less, so you might not get the same benefit, but on the flip side, much less likely and quite unlikely to bring on dyskinesias the longer one is taking that medication category. So unfortunately, with that group of medications, there may be some more bothersome side effects such as sleepiness or leg swelling, impulsive behaviors, among some others. And also it might take longer to slowly build up the medication or titrate the medication to a fully effective dosage.
And I appreciate you touching on that. I mean, you touched on some of the pros and cons of starting sooner versus later. But I've had a lot of people ask me, they're like, well, why didn't I start with carbidopa, levodopa when I started with this other medication? And I think you've kind of touched on, you know, there's a solid reasoning for that because you're personalizing the care.
Correct. And just if I can expound on that a little bit, I also want my patients, I tell them about the phenomenon of, I call it levodopaphobia. So there are some people that are so concerned about taking the strongest medication that they want to put it off till the very last minute. And as a consequence of maybe having some symptoms or even kind of a detriment to quality of life, just for the sole purpose of not taking a medication that might be the best option for that person at that given point in time. Sorry, I interrupted you.
Oh, no, that was perfect. I appreciate you doing that because I think that's an important thing for them to hear. I want to touch on, I think one of the things you said very importantly when you're talking about newly diagnosed patients, you try to personalize the care. So you're working with that individual. Can you touch on, from the clinician perspective, the importance of them providing you appropriate and honest feedback as to how those medications are working? Because you talked about some of the side effects, and I think it's probably hard to personalize if they're not telling you everything that's going on with the medications.
Yeah, that's a very good point. What a patient tells me is so important in helping me to decide how to adjust their treatment regimen to improve the benefit and reduce the side effects. And patients always come with, I hate to say the term agenda because I don't mean it negatively, but some patients always just want to be well, and they don't want to disappoint. So maybe, yeah, I'm not having side effects, I think it's fine. And you have to push them a little bit and say, well, are you really satisfied? Is there something maybe you're not telling me, anything that I should know to potentially make things better for you? And then there are some people who are a bit more sensitive of medications or fearful, and then that might amplify some of the side effects, or they may shy away from even starting the medication due to concern for the side effects, which also would be a problem if they would potentially miss out on the benefit just for fear of something that might happen but isn't necessarily destined to occur when you start a medication.
And I'll touch on your point where you said, they want everything to go well. They want to be well. I think, from what I've heard, and I think we've had this discussion before, that's where the importance of the care partner really comes in, is having a care partner with you at the appointment. They may share things that the patient isn't telling you, correct?
Oh, correct. When a patient comes with a care partner, I'll often tell them that, well, we're going to get both sides of the story. You have your turn first, then you have your turn, and let's hear both sides of the story, and then we'll figure out if the truth is somewhere in the middle or if the story is actually matched. But no, you're right. The care partner is exceedingly important, and sometimes we'll learn information that we didn't get from the patient, him or herself.
Perfect. As we talk about, the care partner, the patient, one of the things I want to touch on, what medications are you aware of in the pipeline or have been recently put on the market that people should really be paying attention to, and how maybe, as you said, they're still treating symptoms, but we've gotten where the medications seem to be treating specific areas. Can you touch on some of those and what areas people maybe should be watching for?
Okay. So as far as medications that are new in the pipeline, recently FDA approved within the last 1 to 2 years are 2 medications. One is called istradefylline, and I believe the brand name is Nurians, and another one is safinamide, and I believe the brand name is Xadago. And those are both designed to help improve on time. They have different mechanisms of action, different side effect profiles, but they're different than what we have on the market today. The medications that we have today to lengthen the on time or reduce off time are rasagiline, selegiline, and entacapone. So these are new categories, different mechanisms of action. So there's a potential they could work when some of our old gold standards have failed. There was a recently approved, I believe it was just in the last 2 weeks, medication called opicapone. It's in the same category as one of our medications already on the market, Comtan, or its generic is entacapone, and it blocks the breakdown of dopamine to help make dosages last longer. And my understanding from reviewing the clinical trials is individual may get 1 to 1.5 hours extra on time, or in converse, 1 to 1.5 hours less off time per day, adding that medication to their carbidopa-levodopa regimen. And in one study, it was compared to the entacapone, which is already on the market, and it showed that it was equally as effective, but the study wasn't designed to determine if it was superior. But we at least know equally as effective and not worse than what's available to us today.
That's good. I mean, that's great to hear that we can extend those on times. I think that's really important. And I think it probably goes back to what you talked about earlier with the carbidopa-levodopa, that the longer we extend the on times, maybe the less you have to up those dosage every so often.
Yeah, correct. And just better quality of life. If somebody has consistent function throughout the day and they're not concerned that they may suddenly have emergence of their tremor or start freezing or just have a general increase in symptoms periodically through the day. So if we can reduce that with extending the on time, that's a great benefit for our patients.
Excellent. Is there anything that isn't out yet that you've heard of that you said, hey, it's phase 3, it's looking good, things we should maybe keep our eye on, or anything you as a clinician are really looking to that you're hoping that you see in the near future?
Well, as I've said in other programs, if people have seen me out there giving talks, I'm just so excited where research has gone in the last few years. And I think it's unprecedented the number of clinical trials that are looking for a disease-modifying therapy. And that means looking for a drug, a pill or an infusion that can slow the progression of Parkinson's. So we're not talking just treating the symptoms, but we're talking about impacting, one's long-term outlook and prognosis with Parkinson's disease. And what I find exciting is there's so many different mechanisms of action that are being studied. There are some drugs that are looking at using the immune system to clear out the bad protein, the alpha-synuclein and the Lewy bodies. So we have a study right now at the Medical College of Wisconsin looking at what's called a monoclonal antibody. So it's an antibody that just tags alpha-synuclein, and it tags it so then our immune system should clean it up and remove it. And the hope is by removing the bad protein that we might be saving some of the dopamine nerve cells that might be near dying off but haven't been lost completely, and potentially then slow the progression of disease. And there's other products on the market of a similar mechanism that are being studied. And there's another research study that's looking at immunizing patients against the alpha-synuclein then to make your own immune system even create those antibodies to try to clear out the Lewy bodies, which is again thought to be the pathology hurting the nerve cells. Another exciting drug is a compound that's akin to what's called exenatide, and that's a diabetic drug. So I'm sure patients have heard about medications used to treat diabetes might help Parkinson's. And this mechanism for this drug is it might block the inflammation that can occur when Lewy bodies and alpha-synuclein build up. It just triggers this cascade of inflammation then that can subsequently lead to cell death. And it's another research study that we hope to get up and running when we're through the COVID pandemic. Right now, everything's been put on hold. So those are some areas of excitement. And then I think thirdly is just looking at what we would call, genetics in medicine or tailored medicine. So identifying certain genetic mutations that are associated with certain subtypes of Parkinson's, and then designing drugs that may be very specific to that mechanism of cell death. So there's research in compounds that work against what's called the LRRK2 mutation, and then also some medications for people who may have the GBA mutation and as their cause for Parkinson's disease. And those are typically young onset, more familial cases as opposed to the sporadic later onset Parkinson's disease.
You gave us a lot. That's awesome to hear, but in a good way. It's really exciting because I think the first one you mentioned is, we're looking at disease modifying medications or drugs. I think that's important because, I've been with Wisconsin Parkinson Association about 7 years now, and every medication that has been new to the market in those 7 years have been symptom specific. We're trying to treat on or off times, we're trying to treat hallucinations. It's always been, whereas this may actually slow the progression of the disease. So I think that's very exciting, not just for you as a clinician, but for us as an organization and the people probably listening to this. So I think that's really, really great information. As you talked about it, you mentioned Lewy bodies a couple times. And one of the things I want to ask you maybe to clarify, because I hear this a lot, when people hear Lewy bodies, right away they think of Lewy body dementia. And they assume, well, if I have Lewy bodies, that means but it actually maybe means something a little different. And can you touch a little bit on what Lewy bodies mean when they're present in Parkinson's disease?
Okay. Yeah, that's actually a really good question, and I feel bad when patients misunderstand. So the Lewy body is what we see under the microscope. So if I were to look at a nerve cell under the microscope, I'll see this little red dot or inclusion, and it's a clump of the protein alpha-synuclein, and that's what we call the Lewy body. In Parkinson's disease, the Lewy bodies are located in the midbrain, in the movement part of the brain, and also a bit in the intestines, and that's why a person has constipation, and it can be in the nerves for the nose, and that's why there's a loss of sense of smell. In Lewy body dementia, those Lewy bodies, or those red spots that we see in the nerve cells, are in the the cortex. I always have to use my hands to describe. So the cortex is the outer part, or the thinking part of the brain, and that's where they deposit first. And that's why memory is so severely impacted. And it's not just staying lower down in the brainstem and the movement areas. So even though the pathology is the same, we see these red spots in the neurons under the microscope, but where they were deposited in the brain is different, and that makes those diseases very distinctly different. So I hope that explanation helped.
I think it does. It's very good. It's one I hear a lot of times where people, unfortunately, Lewy body dementia is named Lewy body, but we know the Lewy bodies are present. So it does get confusion. I think you did a great job of explaining the difference between the two. So I appreciate it, and hopefully people watching appreciate it.
Okay.
We've touched on a lot of different things. I mean, I think you've given us some great hope for stuff in the pipeline. I'm going to give you kind of a no real good answer question, because there's probably 100 different options. But one of the questions we get, what is the most common medication things you hear as a movement disorder specialist? What are the things your patients are asking you in regards to medications that you see quite frequently?
Yeah. Oh boy. I'd have to say, honestly, one of the most common questions is, what do I think about the use of CBD oil or marijuana in Parkinson's disease? I bet you kind of saw that coming. Very common question. And the honest answer still is we just don't have science behind it to prove that it works. But I can appreciate why one would be tempted to try something, because there's a lot of anecdotal information out there, a lot of advertisements that really make it seem like it'd be a useful and helpful treatment, but the science isn't there behind it. And my concern with some of those substances is they're not regulated. So you just don't quite know what you're getting as far as purity, potency, and so forth. So I'm not negating it, that maybe someday we'll learn how to manufacture it in a more standard way, and maybe it would be useful and we'll prove it in a clinical trial, but we just don't have that information now for me to endorse that it's a treatment that everybody should take.
Well, and the thing I always hear too is it's not legal in Wisconsin yet. So
that's a big problem.
Right.
And CBD oil, yes, but the marijuana, no. So you're right. That's a big problem.
So it's hard to say, yeah, go do that, because it is not fully legal in Wisconsin. And you're right, the anecdotal evidence is out there. But I know a number of organizations, and that's where Michael J. Fox Foundation does a great job. And they've done research on cannabis, and they've kind of said the same thing: is there's some positive, there's some negative, but we're just not sure because there's so much variety in the cannabis strand to try and figure some of that out. Last question for you. Anything we missed that you want to touch on that you're like, really want to make sure people understand, this, that, or the other thing?
I think my parting words would be, just remain hopeful because of how much research is taking place, and organizations like the Michael J. Fox Foundation, Wisconsin Parkinson Association, all these organizations that are here to support patients as well as funding research. So there's a lot of reason to be hopeful. There's a lot of research taking place. There's a lot of support. And I'm going to sort of veer off topic, but I can't miss putting in a plug just for the importance of exercise and staying active. When we talk about things that might slow the progression of Parkinson's disease, we know exercise is proven. And I know that's why the WPA is a strong supporter of exercise. And I know you've been putting things on the website to help people keep going during this time of the social distancing. But I just don't want to underscore the importance of staying active. And it doesn't mean going to a gym. It can mean simply going for a walk, or if you need to stay at home to stay safe, you can walk around your house. You can do some simple sit and stand from a chair. There's videos you can watch and exercise along with for the WPA. So it doesn't have to be expensive. It doesn't have to be fancy. It can be simple. Just keep your body moving, because it'll serve you in the long run.
Those are great parting words. I think exercise is so important, and I'm sure it really amplifies what you can do with the medication side then. So
yeah, absolutely, it's a very important adjunct.
Well, Dr. Blindauer, thank you so much for your time today and providing us a lot of hope for what's coming down the pipeline, and for those receiving treatment for Parkinson's disease. And while we are all practicing social distancing, please check in with Wisconsin Parkinson Association frequently. We are regularly updating our website and Facebook page with exercise classes, educational videos such as this one, and a number of other resources for you to continue to stay safer at home. You can also email us at mail@wiparkinson.org which future topics you'd like to see us cover by local experts in the area. Now, hopefully you're finding this educational video series beneficial. WPA relies on donations from individuals just like yourself. Please consider a gift today at wiparkinson.org to continue to keep all WPA programs now and in the future free to all. Once again, I'd like to thank Dr. Blindauer for being our guest today. Thanks to you for joining us. Please take care and be safe.